Hello, everyone, and welcome to Grand Rounds today. My name is Ashley Dennis, and I'm the Director for the Office of Medical Education. Just a reminder that if you're wanting to claim CME credit, that you need to click on the link that my colleague Ashley has put into the chat box or within the email that she has sent out. And now I'd like to introduce our speakers for today. Dr. Koo is our lead for the Infectious Disease Department. He joined Billings Clinic in 2019. He did his undergrad at Spring Hill College, medical school at the University of South Alabama College of Medicine, residency at the University of Arkansas for Medical Sciences, and his fellowship in infectious diseases at the University of New Mexico. And today he's going to be speaking about demystifying the COVID-19 vaccines. He is also joined today by Nancy Iverson, who is currently the Director of Patient Safety and Infectious Control at Billings Clinic. She's been practicing nursing for 35 years, and her special interests include hospital-based infection prevention and control, surgical infection prevention, multi-drug resistant organisms, environmental hygiene, and infection prevention during construction. So she's going to be here to support him, and if you have questions, here to help you answer those. Thank you so much, Dr. Koo. Over to you.
Thank you very much for that introduction. And I'm really happy to be up here to kind of talk about something that's been going on for that's been circulating on the news. And of course, it's our favorite topic, the COVID-19 vaccines. My title, my presentation, Demystifying the COVID-19 vaccines, isn't so much to kind of clarify about the vaccine themselves, but really to kind of explain the demystify this phenomenon of vaccine hesitancy that we are currently seeing, and hopefully will also provide some strategies to help demystify the vaccines for patients who approach you and they're discussing to decide whether or not they should get the vaccine. Just about my disclosure, I don't have any. The main objectives for my presentation today is really briefly talk about some of the factors that are leading to vaccine hesitancy and refusal. I will point out some new data, safety data regarding the COVID-19 vaccines. Hopefully will kind of help with supporting arguments for convincing your patients to get the vaccines. Certainly, as part of that, we'll talk about some of the strategies that could be employed to help overcome the vaccine hesitancies, and then I will have a very brief discussion regarding future and challenges regarding the COVID-19 and how that may make some of the discussions that you may have or questions that may appear that you may have to address. So I would like to begin with our current COVID-19 status, and so this is actually data that just got that was published earlier today. So in the United States, we have almost 32 million cases of COVID-19 since the first case that was diagnosed over a year ago, and since then there have been over 500,000 deaths as a result of COVID-19. Since the initiation of the vaccination program, about 27% of the U.S. population have been fully vaccinated, and currently the percentage of vaccine doses that's being used that's available has been about 78%. In Montana, we have had about just over 100,000 cases of COVID-19, resulting in about 1,500 deaths. Currently our vaccination rate is about those who are fully vaccinated, it's about 29% of the population. Now, this will be a little bit different than what Governor John Forte have been quoted, just for those in case that you're fact-checking me. But so for those who follow Governor John Forte on his Twitter feed, is that he is actually using calculation based on eligible population rather than the total population. So the numbers are a little bit more large. The percentage of those who have received at least one dose fully vaccinated are higher than what I'm quoting. But if we're again trying to reach that goal of herd immunity, we really have to consider the entire population, not just those who are eligible to receive the vaccine. Now, in Montana, we are using about 76% of the supplies that we are given. And now, so certainly this is part of a reason for this presentation is that we're certainly not using as many doses of vaccine or vaccinating as many people as we would like to. And finally, just kind of to add on to some of the current statistics for some closer to home, is that roughly just under 60% of our employees at Billings Clinic have been fully vaccinated. So, so I wanted to kind of present this because some of what we are seeing is, and this is kind of mimic what's going on in the U.S., is that the desire for vaccination, that the incentive has gone down. That there's now that, looking at this graph, that the average number of cases of doses given per day has peaked and now appears to be going on a downward trend. And this is actually despite the fact that the eligibility for the vaccine has been essentially been fully open to those who meet the FDA indications. So, certainly this is of concern, again, if we are to try to reach our goal of herd immunity and then to get back to normal, we're probably won't get there at this rate. Of other statistics I kind of want to bring to your attention is that that this is a poll from the Kaiser Family Foundation, looking at the essential workers, non-healthcare essential workers, and whether they have gotten a vaccine or have already received a vaccine, and if not, will they get it? And it's interesting, I wanted to point out that about 1 in 5 of these essential non-healthcare workers have elected not to get vaccinated. Now, and this is concerning as this, because of their fact that they're essential workers, they've made a huge impact in our economy and our, how mainly in our economy and how things are going with how sustaining the infrastructure of the U.S. So certainly that this is of a concern, especially in light of this, not increasing number of cases of COVID-19 that we're experiencing at certain parts of the country. Other interesting points I wanted to make is that, that among the states with the highest number of hesitancy, Montana ranked as actually is included in one of the top 8 states. So, and they're estimating about 20% of the population is reluctant or resistant to getting the vaccine. I had a discussion recently with the Department of Human Health Services, and what we're told was that, as of this was Tuesday afternoon, that about almost just under 150,000 doses of vaccine has yet to be used, and that there are counties in Montana that have been not reordering or refusing shipments of vaccine because they've had an oversupply of this vaccine. So. So certainly there is a great, again, as I point out, the great concern that the interest in getting vaccinated has significantly waned. So why so many doses are not being administered? What has changed? We went from months ago where we could barely get enough vaccine because there was such a high demand to. We can barely give them away now, and there's so much still waiting in the freezer. So what has changed that kind of led to this, to this change in the interest of vaccine? Well, certainly I think part of that had to play. Part of that is because at the beginning of the vaccination program, we're focusing on those groups that had felt the need to get vaccinated because of their risk factors. So, so those are the healthcare workers, and as well as those who are first-line workers, as well as the those who are high risk for complications or serious illness due to COVID-19. But many of those, if not many of those, have already received their vaccines. So now we're shifting the population to those who are, don't have, meet those criteria where they're at higher risk of getting the infection or at higher risk for developing complications. So, and then the sentiment is that, there's a question of need and certainly of need, especially in light of what we're seeing now in the number of cases and deaths due to COVID-19. It has, in the last several weeks, has significantly dropped. And so this is, and a recent poll a recent Gallup poll had identified that the Americans seem to be less worried about getting COVID-19. And on top of this, there is still a fair bit of misinformation regarding COVID-19 and the vaccine that's circulating around on the internet. And I just did a Google search of some of these just to see what's out there, and it ranges from a lot of kind of you do wonder where they kind of got this information from. The posting from the left kind of suggested something about a patent of the vaccine and that it had already expired, and why are they giving it out? To why all of a sudden, how did this vaccine came about so quickly, where vaccines for other conditions are still in the works. So there's a lot of this misinformation circulating. Here's a couple other ones. The one on the left on Twitter has kind of talked about, indicated about, how pointing out how Dr. Anthony Fauci's been wrong so many times. So why should we believe him now? To again, on the right, where someone had indicated that their spouse had worked for one of the pharmaceutical companies and claimed that the vaccine caused sterility in women. So things like this are certainly in social media. It continues to be circulating. And then we see this on the news. Hearing with the news media kind of really sensationalized a lot of the some of the things that of the adverse reactions that we do hear about the vaccine, and I'm trying to downplay the significance of this, but certainly this makes a significant impact on those who are kind of on the fence about trying to decide whether should they get the vaccine or not. And certainly I think that most who the public who are not as understanding about how vaccines are developed and the clinical trials work, that could perceive this as something as that the risk of getting this is really bad if they went ahead and got the COVID-19 vaccine. And then, and certainly didn't help, and this was a lot of our medical community had concerns about the decision by the CDC and FDA to put the Johnson & Johnson COVID-19 vaccine on pause, because again, a lot of it. Our concern is that this gives this perception that there is something really seriously wrong, and justify a lot of the doubts that many of those who have yet to get the vaccine and still on the fence. And certainly there are on the left is a headline from a website that's not as reputable, but people are going to look when they do a search. Articles like this will pop up where speculating that the vaccines could do serious harm to the public. So, and then we shift to the more of the political realm, where getting the vaccine is a political issue. And this is a poll from the New York Times about a little bit over a week ago, where a significant number of those who claim who identifies themselves as Republicans had just refused to get the vaccine. the scope of vaccine hesitancy is not even limited to just to that, but also to religious beliefs. Where, and this came out several weeks ago, where there were concerns, particularly from the Catholic Church, that the Johnson & Johnson vaccine would derive from aborted fetal tissues, and again, faith leaders are advocating that their practitioners should avoid getting vaccinated, at least with the Johnson & Johnson vaccine, because for moral reasons. And then finally, you got those who just don't want to do it because they don't want to be told what to do. And so you have that group, and also to kind of and as part of the pot of all why they don't want why they don't want to get vaccinated. So, which kind of leads to the subject of my discussion today in my presentation, which regarding vaccine hesitancy, and the term that's been kind of used loosely, especially within the news media, but it's really essentially it's a term to kind of describes attitudes and belief where someone just will voluntarily decide to refuse or delay vaccination despite the fact that that vaccine is readily available to them. Now, this is something that many pediatricians and family practitioners encounter, as because they're probably by far would be the clinicians who are more involved into recommending vaccines, and then as well as some in internists as well. But this concept is also not new, and it's been it's been around, and we commonly kind of call really actually identify these those who are kind of fall in that categories as the anti-vaxxers. So now, if we're looking at vaccine hesitancy, really, it's not a term at which is someone, is an exact definition fit into a specific definition. It is really actually a description of a spectrum of how people perceive the vaccines, where on one hand that there are going to be those who are very willing to somewhat willing to get the vaccine, to those who are on the opposite end of the spectrum, where they're going to see, they're finding reasons why they shouldn't, to I do not want to get the vaccine whatsoever. So, and again, we're more familiar with those anti-vaxxers, and those and many of those are not necessarily the what people would consider they're out of their minds, or they're just crazy, but that they're rational people who have a in their mind have developed a rational explanation why vaccines are bad, and that why they should not be that should not receive them, and also should not be given to others. Now, there are really vaccine hesitancy, as I mentioned, is a spectrum of attitude and beliefs, and there are a lot of different facets that kind of play, kind of contribute to that, those attitudes and beliefs. And they're ranging from perceptions of need and the risk of vaccination, to some information that people have, they have gotten from others or from the internet, to some degree of knowledge gap. There are a lot who do not trust the safety and effectiveness of vaccines, and certainly those experts who advocate for it. As I kind of pointed out, politics plays a very big role. And then finally, there are some cultural and religious reasons that why some populations are less likely to are less willing to get vaccinated. Now, this is a poll that was performed by the Delphi group at the Carnegie Mellon University and was published in Vox. But what I want to kind of point out is that there aren't that many, and there are a lot of kind of reports of why people don't want to get vaccinated. But this is at least a survey of some of the common reason why those people who have not been vaccinated with the COVID-19 vaccine, why they just choose not to when they're offered. Now, probably the two, certainly, and I'm highlighting there of some of this, what I'm highlighting is the concerns are, here in this case, concerns about what the vaccine can do. So concerns about side effects, anaphylactic reaction, is it safe to use? Also, there is this trust issue. So there are a significant number of people who do not trust the vaccine, or they don't trust the government because for a variety of reasons, and who at this time are the really primarily the ones who are offering the vaccine. And then you got those who are questioning, is this something I really need? And does it really work? And when we're hearing, reports about how those sporadic reports about someone who's been fully vaccinated and still come down with COVID-19, that puts a lot of doubt in those. It's like, if that happened to this person, why should I bother? So there is, certainly these are some of the top reasons why people have chosen not to get the COVID-19 vaccines. Now, if you really boil it down to it, there are really three key elements to this vaccine hesitancy. And certainly, the first one is this distrust of health authorities and experts. And they just don't really trust the person who is telling them that they should get the vaccine. The other is the vaccine confidence in the vaccines. There's a lot of questions about, does this really work? And that's not just whether it works or not, but is it safe to be administered? And when the mRNA vaccine first came out, there was this huge flurry of communication and concerns regarding whether because it contains the RNA, people are worried about will this alter my DNA or whatnot. And so certainly there are so lack of confidence certainly plays a big role. And then finally, there's this fear. What can this do to you? Will it, for those who are, want to get pregnant, will it cause birth defects? Will it prevent me from getting pregnant? Things like that. So, and although people will have, it's easy to categorize these elements of hesitancy. What I've noticed, at least what I'm hearing, is that many people have overlapping, a lot of, they either have two or three out of these three key elements. But these are the three key elements I do kind of see recurrently regarding why someone would not want to get vaccinated. Now, just to make things even more interesting, there are other factors to consider because it's just not boiled down to just those three things. And as we're trying to encourage and have a discussion with our patients about getting vaccinated, we do have to look at these contexts because I think that we as clinicians have, a lot of ways make a lot of assumptions about where patients are and why and what they should, what we think they should do. Well, the first thing is that not everyone shared the same view. All three of these scenarios, they have three very different reasons why they want to get vaccinated or not vaccinated. The younger population tend to not want to get vaccinated. A lot of them because they don't see this as an acute. They don't hear this as an illness that primarily affects them, and many of them think that it's just like a cold. I'll get over this. And then on the right lower corner, you have someone who has severe lung disease. Yes, I found this photo of him still smoking. And this guy likely want to get vaccinated because he knows that he is very high risk from dying from COVID-19. So his incentives are very different. And then finally, the right upper corner, you have the anti-vaxxers and refuse to believe anything, and they're not going to get vaccinated, not because of all the other, it's just because they, whatever reason they decide to choose, they will not get vaccinated. The other thing to consider is that many people already have, as you're discussing, they already have biases that's been established. Many of them know that the COVID-19 vaccines are not FDA approved. So so certainly they know there is concern about that puts a little bit of a seed of doubt in the safety of these vaccines. some already have existing knowledge about vaccines, and whether from experience or from which I kind of pointed out, or from what they've heard from others. Certainly, misinformations, and just like the one of the text postings from Facebook about people who are who have had a bad outcome. They hear about this. It doesn't matter if it's whether that's true or not, but that seed of doubt by reading that has already been placed in their minds, and that makes it very hard for people to kind of sometimes hard to kind of overcome that fear, because it's sometimes in some ways it reinforced what they're really worried about with the vaccines. And then finally, there are some cultural and religious influence that we have to consider. Cultural wise, we have to look at African Americans who have had, who are during this pandemic have been impacted significantly. The number of hospitalization as well as deaths. But there also been, there's a lot of reluctance to them getting vaccinated because of what has, for a variety of reasons, what they've been experimented on. I think the more common one was the two that's been brought up was in the early 1900s, where some the women were underwent a gynecologic experiments without anesthesia, to the Tuskegee experiments, where these Air Force Tuskegee men were infected with syphilis and without their knowing. So there is distrust in the government, and since this is being provided by the government, certainly it's understandable that they would think that getting the vaccine may be a form of trying to experiment a treatment on them. And then, of course, we have the religious concept, and as I pointed out earlier, is the fact that misinformation regarding that the Johnson & Johnson vaccine was developed using aborted fetal tissues, and so these are things that we have to kind of understand and pay attention to as if we're going to try to have a moment to sit down with them to discuss about why they should get vaccinated. This is another thing. Another big hurdle for us is that not everyone agrees who the expert is. All of these. This is where a lot of people get their information. Whether you either one or two, or depending on who you talk to. And this is kind of really where it gets really concerning, because I'm sure all these different sources I listed here, and I'm sure there are all many other sources, have very differing information. So that's something that certainly we have to consider as when we talk to our patients. And then another thing is that, and this is something I encounter fairly often. Many people filter their information they get. They hear what they want to hear. Now, they will get their information either from their friends or from the internet. And then they're going to take what they hear and then pick out what they want to keep. And then eventually they build their knowledge on that information and the rationale that comes as a result of that. So again, as we're explaining, especially with medical facts, it is going to be very hard sometimes to kind of give them the straight facts, because that's not necessarily what they want to hear, and that will they will likely to come up with a reason why they will counter that, and that's kind of something I will kind of touch on a little bit later. And then finally, medical providers don't always communicate very well. We, as a medical providers, we do have more of many of us have more of a dogmatic way of explaining things. We are the experts. We're going to tell you what to do, what you need to hear. And and this gets a little challenging, because again, as I mentioned, people previously, that people will filter the information they want to hear, and what you say to them may not stick, because that's not what they want. So it's important to understand where they're coming from, and then find ways to kind address it from that angle than trying to do it heads on with this. You need to do this, or you're going to die, or something to that effect. Now, finally, there is a disconnect between what we as medical providers, how we view vaccination, and how the public view vaccinations. So we as healthcare providers, we look at vaccination differently, obviously. We look at it in the context of, well, why should we vaccinate? Well, we know that we certainly it will decrease the number of hospitalization, decrease mortality, and that, we know that there are some complications, there are some adverse events that's associated with the vaccine, but we feel that the benefit of vaccination certainly outweighs any of the potential risks. But the public don't really see it that way. They're questioning, why should I get this vaccine? Well, do I really need it? I mean, talking to a 20-year-old who, in their mind, they're thinking, well, I can get the if I get sick, I usually recover, and so why do I need to bother? So certainly they are, so they don't see what we're seeing. They're questioning, what does this really mean to me? Do I really need the vaccines? What will the vaccine do for me? Will it get things back to normal? This is a very common question. Is the vaccine safe to use? Can I trust the vaccine? Certainly that's a big issue, because of how quickly the vaccine came out. And then a lot of them are just gonna say, I don't want it. I mean, because I don't want to get vaccinated, because I don't feel that the risk of getting COVID-19 is great enough to warrant to go through the whole to get vaccinated, especially if they're looking in the context of hearing other people coming down with symptoms, the vaccine related symptoms, is it really worth that hassle, feeling bad for a couple of days? So and even though we may think this may be very silly, but to them this is a significant factors that they take to heart. Certainly a disconnect. So where do we start demystifying this? And in other words, there's a lot, I think, from, and what I mean by this is, how do we look at these vaccine hesitant individuals, and how do we start sorting things out and address this issue? Because again, as I pointed out, you can't, it's not a simple, here, this is what you need to do. And you should listen to this is the doctor's advice, doctor's orders, and follow through with that. That it's not, unfortunately, it's not that simple, because there's so many other factors going to play. So the way I looked at this, as I'm kind of had put this this presentation together, is I kind of think of this like putting on my ID physician hat on here, treating this as addressing an infection and doing an infection workup. How do I address this? Well, the first thing is there is no one-size-fits-all strategy. So in other words, I guess in the ID realm is that given someone Bosun, that's vancomycin and pitazo, is not going to fix this problem. So we have so you have to set that. You can't just sit down and say this is what you have to do and then walk off. It's not going to work, because you're not going to convince them to get vaccinated. The first thing to do is the next thing to do is you don't assume what's really wrong, why they feel that way. Again, I do that. We do this. I get a lot of consults with a lot of assumptions. Got to listen and figure out what's going on. Listen actively. Get a good history of why they feel the way they do. And this is really, really important, because you want to pick up is what are the issues that they have and what you can address. So whether this is a mistrust of experts, is there fear, is it because some his ex-brother-in-law told him that COVID-19 does this, whatever. It definitely want to know what exactly, and so this is identifying the source. What is actually going on that's leading to them to be hesitant? The other part is that it is really important for us as healthcare providers to be the content expert. And this is one of the reasons I had put out that FAQ, vaccine FAQ, is because if they don't get the information from you, from someone else. So we need to be the content experts. And so try to establish yourself as the expert. Take the time to sit down with your patient. If you get a question or a call from a patient regarding whether they should get the vaccine or not, you want them to listen to you. So take the time to sit down and talk to them. Now, certainly, I try to be as comprehensive with that FAQ as possible, but there are probably going to be times you will want to get more information. So it is important to use the reliable websites for this information, or to refer your patients to. So that again, if you don't help them, nudge them in the direction of where to get their information, they're going to find it. And it may not be what you want them to know, or what you want them to believe. So now I put this next point in because of all the hoo-ha that had happened earlier on in the pandemic. And I just speaking from an academic standpoint, I have never seen so many preprints become the actual the paper at which everything's get referred to accepted, what the conclusion of those papers to be the accepted fact. Now, and so so I really recommend that until there's actually a paper or data that's being produced has been peer reviewed and actually been embedded, I would avoid using those avoid using whatever information you get out of them as facts. Now, there is although we want to make sure we give as much facts to our patients as possible, do want to make sure that you focus the facts on that will reinforce your points. And it is easy to give too much facts because you're not, and it is really easy to inundate these patients with facts. And so you want to use the facts in a way to that it reinforce your points. Now, as I point out, you're going to many of these patients, these individuals, they're not so much as as unknowing. In other words, there's many of them will have a knowledge gap, but many of them probably will already have done some degree of research, either through social media or Dr. Google. So you want to be ready to counter any of these misinformation that they're going to give you, because because that's really a lot of that information is why they were probably not getting the vaccine. So, and they're going to bring that up to you, and so you have to be ready to prepare to make sure that get them on the right fact and information to them. And then finally, I added this because there's still a lot of unknowns regarding COVID-19 and the COVID-19 vaccines. And patients will likely, and I get asked a lot of this, is opinions about how things are going to, well, we need an extra dose or whatever. And I think that, although they, it's good that at least they're asking you as a healthcare provider that about these questions. But I think that, that really, if you don't have a definite answer, I would try to steer clear of opinions because that will mislead a lot of mislead them, and in some ways that may actually be worse off. And the example I'm giving is that about again earlier this week when the meeting with DPHHS and all the ID physicians, one of the public health nurses commented that a patient decided not to get vaccinated is because someone had mentioned to them that there is a possibility they may get a third dose. And they didn't, and they were worried that given all the severe, all the significant side effects that he's had heard about the vaccine, that he just don't want to go through that 3 times. So he decided not to get vaccinated. So I think that it is really kind of be careful, not discouraging, not an absolute do not give opinions, but kind of be careful how you relay that opinion, because it definitely will influence their decision to get vaccinated or not. Now, what are the good and reliable sources of information? These are some of the sites that I would recommend. Riverstone has a site where they can provide the, where their documents and guidance documents. A lot of it I actually help put together, so that's the second part. So those are good sites where you can get information about the vaccine. But even though there's a lot of issues with CDC, they're still going to be considered to be the one of the go-to sites for information regarding COVID-19. Two other sites that are just as good as the COVID-19 Real-Time Learning Network. This is actually off of the IDSA, Infectious Disease Societies of America, a website where it's a site just dedicated to everything you care to know about COVID-19. So that's a good place, and there is a vaccine FAQ, so that's a good site to look. The New England Journal. It's kind of the something that we all are familiar with, and there is also a good vaccine FAQ. I think that's being put together, moderated by Paul Sachs, one of the well-known HIV providers, I think in Harvard. So yeah. So what do you do now? Now that you have known all these, when you're counseling vaccine recipients, what should you do? Well, first off is certainly you do not want to be dismissive. If they're reluctant for reasons, and I knew it, and it is, don't assume why they're or at least assume the reason that they're hesitant, but and certainly don't want to dismiss them. If they're and having a discussion with you about the vaccine, they're at the point where they're at least willing to listen and willing to get it. So just really need to find a way to nudge them. So certainly don't want to be dismissive. You want to be reassuring, and sometimes that's all you need. They just want to make, their doctor telling them that the vaccine is safe. And you can tell them, hey, I got the vaccine weeks ago and I'm fine. I don't feel bad, feel anything bad at all. So I think they just need to hear that from their physicians. Now, if you have, and through the careful listening, identified the causes or the things that they're concerned about, then you want to focus on those reasons for the vaccine hesitancy. So again, you don't want to get too broad, but you want to answer the question, the reason, address the reason why they're hesitant, and then focus, and as well as what the vaccine can do for them. Because that's really, that's going to be the two things that they want to hear the positives. And so we want to kind of, and the reassurance. So certainly focus on that. I would certainly also suggest not to try to explain in layman's terms. And I know that this is kind of, most of us do, try to do that. But I think that, trying to quote things in the context of data is really, really hard. Especially that's, for example, the Johnson & Johnson vaccine, and its 62% effectiveness. It's becoming, certainly, people will have a misunderstanding of what that really means. So we do need to kind of have to, kind of digest the data a little bit, and so that in ways that they will understand. So that will help convince them to get vaccinated. One of the things is, and I am guilty of doing this, is trying to explain things in the terms of risks. And the challenge is that how people look at risk are very, very different. Certainly when we're talking about, we as healthcare providers talk about risk, we don't think in that same context. We think in a very more rational context where it's rational based on scientific data. Most laymen don't do that. They look at risk in the terms, in emotional terms, where how will this affect other things, such as my ability to have more children? Will this cause me to have cancers? Things like that. That's how they're looking at this. And if there's doubt, even though the vaccine may be very effective, if there is enough doubt in there, they won't get the vaccine. So I think, so again, keep in mind that this is going to be something that's real, when you're talking, if you're going to use discussion about risk, they're going to look at it very differently than how we look at it. Now, as I pointed out, we certainly have to consider, it's not just going to be, if you're not making any headways in convincing them, there's probably going to be more than one factor in play. So if you're not, so certainly dig more if that's into the situation, into what else is going on if you're not making any success with convincing them. And then finally, don't force this. I mean, again, you don't, we certainly don't recommend trying to badger them or, kind of strong arm them into getting the vaccine. A lot of people just need that time to digest the information and feel comfortable. And so, so if they're, if they're giving you the opportunity to say, hey, can we just meet up and talk about this down the road, maybe a few days later, sure, let them have that opportunity, because again, they likely, it's a good chance that they're going to turn around and make the decision to get vaccinated. The other thing as you're explaining things is that try to use, if you can, visual aids. So this is a visual aid I've had for when the Johnson & Johnson vaccine, when it just got put on pause. This is a infographic, kind of explain and give a better description of the risk of getting the cerebral venous sinus thrombosis compared to all the other conditions. And now you could certainly spout out and say, well, there were only 6 cases out of 6.8 million doses given. Most people don't imagine that, visualize that. So you have to compare it to something that they will understand. And then that's what this infographic helps to do. Look at how what's the incidence in the general public to those who actually get COVID-19. But probably what's the most helpful is, and I think people probably have better understanding of this, is that on the right lower corner, they also listed the odds of getting struck by lightning, which is 1 in 500,000. So the likelihood of you get struck by lightning is much, much greater than getting the CVST from the Johnson & Johnson vaccine. And most of us, at least I personally, have not experienced getting struck by lightning. So to me, wow, if I've never gotten struck by lightning, I don't know anyone who got struck by lightning, the likelihood of me getting CVST is even much, much lower. So I think having something that they can relate to really will help them understand this. Now, getting close to the end, but these are this is another area that this is really where we have a large group of vaccine hesitant people, and this is the populations that for cultural reasons and some religious. Again, as I pointed out earlier, the African Americans have a very large, many of them are reluctant to get that because of what either their parents have gone through or knowing someone has went through, and so we certainly need to reach out to them. We can't expect them to come to us. African Americans, Native Americans, even the Latinx populations, all of them have suffered to some degree of limited access. Their impression of public health has been not really favorable because of lack of adequate level of care that's been provided to those specific populations. So we do have to kind of reach out to them and try to help overcome some of those cultural reasons. So really my key point here is really we have to empathize with them, not ostracize. We should not, we really cannot just dismiss them, kind of tell them, okay, you're crazy thinking and you should need to get the vaccine. Do need to understand why they're doing this. And this is not just for the COVID-19 vaccine. This is for any vaccines. For example, the measles, vaccines. I mean, we take for granted of how about the incidence of measles in this country until we start seeing cases, outbreaks of it because of certain groups had elected not to get vaccinated. So but we need to understand why they're not wanting to get vaccinated, so we can encourage them to vaccinate. So, and then we have to recognize not everyone will want to be vaccinated, and this. So if if you're unable to convince someone, then I mean, don't think of it as a failure. Really treat this. You don't have to win all the battles. What we're really aiming for is to win the war. That meaning trying to get as many people vaccinated as possible. All right. Just a few slides left. I mean, as I mentioned, I'm going to touch on some new data that just came out. This is just was published in a New England Journal about the mRNA. This is specifically both the Pfizer and the Moderna vaccines, and this was a survey and study that was done via the BeSafe and VAERS system, and that what they have shown is that the adverse reactions, the solicited and unsolicited reactions, were not much different than those of non-pregnant women, and then the outcome has not been significantly above their pregnancy were significantly different from those who had not received the vaccine. In other words, these are some preliminary findings. Hopefully, in the coming weeks, we'll have more concrete data to kind of make the to say that yes, this is definitely safe. But this is very encouraging to see that there is good, strong evidence that the COVID-19 vaccine, the mRNA vaccine, is safe in pregnant individuals. And then this other is that, and big news mostly for the pediatricians and family practitioners, is that Pfizer BioNTech has done the studies on the vaccine from 12 to 15-year-olds and showed a very, very good efficacy. They're claiming 100%, and having good, robust antibody responses, and which is actually this particular study is what is leading them to their plan to submit an application to make the vaccine available for this group, a pediatric population. So, and then they also commented in here that they're now looking at 6 months or 11 years old. So hopefully they'll publish. It's probably not going to be an official published in a way that like the previous paper, but probably the data will be presented to the FDA through their VRBEC, and then as well as ACIP for their final endorsements. What are the future challenges, especially with trying to overcoming vaccine hesitancy? These are just some of the things I was thinking about. What about the variants? And this kind of leads to, again, questions about whether, how effective are these vaccines, and will I need to have future doses? Again, I don't have a really good answer. I do have to say that at least for the B.1.1.7 variant, that the Pfizer and the Moderna vaccines have been really good. So there's no concerns regarding that. So those two mRNA vaccines. What about to those who are, what do we need to have booster shots, extra shots? How long with the vaccine? How long are they effective? And then finally, will it change? This is a big thing. Is it change what we do? Will it mean that if you're vaccinated, can we now walk around without mask on or physically distance? There's still a lot of questions, and unfortunately, they do influence people's decision whether to get vaccinated or not, because they have to see this as something worthwhile. If it doesn't change what they do, they're probably less likely to go forth with getting vaccinated. So in summary, the vaccine hesitancy is a term that's kind of describes this range of beliefs and attitude toward vaccines, and why they, despite the fact that are readily available. As I kind of pointed out, vaccine hesitancy is really the causes of it are very complex, and there are many facets to it. There is no one-size-fits-all strategy to address vaccine hesitancy. We have to tailor to what is driving that sentiment. It is important, and I can't stress this more. We have to be empathetic because many of these patients individuals are kind of scared. They are scared. That's why they're why they haven't gotten the vaccine. And so we do need to understand where they're coming from, so that and we need to reassure them that this is the right thing to do. And then finally, the goal is to vaccinate as many people as possible. So it's really trying to get to reach that point of herd immunity, rather than, and you're going to have to, we just have to accept that there are going to be some we're not going to be successful in vaccinating. And this is the end of my presentation. Thank you very much for listening.
Thank you so much, Dr. Koo. For those of you that have any further questions, please take a moment and put them into the chat box. We do have a couple of questions that have come in. So the first one is, my understanding that the evidence for this type of mRNA vaccine is pretty robust regarding safety and efficacy, although not commonly used yet. Is this true?
So, so the question is the technology for the mRNA vaccines new? And the answer is no. It's been around for at least a couple of decades, and it's been used in other contexts. So it was, I believe, that were really originally looked at this for cancer research and such, and less so with infectious diseases. So although there have been some, from what I've read, is that they had to looked at using this technology for Zika as well as Ebola vaccines. So the technology has existed for a while. It's just now it's really applying this particular scenario, this particular virus, and then put it into that technology to offer hopefully create immunity in us to prevent COVID-19.
Thank you. And the second question is, knowing that a strong recommendation from a medical provider is one of the best tools to combat hesitancy, what is Billings Clinic's plan to bring vaccines to individual clinics?
That's a really good question, and actually that's kind of in the works right now. So so just kind of give you a quick timeline, as certainly when the vaccines first came out, we as well, Billings Clinic as well as St. Vincent's have been the two major centers that started with created our own little vaccination centers to provide the vaccines for the community. And then I think a few weeks after the Riverstone started doing that. But as the demand and the demand had been for vaccination increased, the Unified Health Command met and decided that maybe it would have been more practical to consolidate all our resources and to set up these community-based vaccine clinics, which is where we had the Metra as well as the Shriner auditoriums. Now we have noticed that the UHC has noticed that the interest in vaccination has significantly dropped, and there's a lot of concerns about that, because we're looking to reach out. They're looking at this and deciding to instead of centralizing the vaccine efforts, is to kind of get it out to as many places as possible. So I know we're going to have the COVID operations team. Hopefully, I believe we'll meet next week to kind of discuss about how to do that, and then hopefully we'll have a plan, and then more to come as a result of that.
Perfect. Thank you so much. Nancy, is there anything else that you'd like to say before we end today? Or Dr. Koo too?
No, just thank you for attending, everyone. And that's the most important thing. And your questions, and I think there was a comment that we appreciate, but related to safety and efficacy, I don't know if people quite realize that to get this vaccine into the arms of our citizens, it went through the same phases of clinical trials that fully licensed vaccines go through. I think that's a fact that is not known to everybody. And for safety, each phase of the vaccine goes through certain endpoints. It doesn't go on to the next phase unless safety and then efficacy and the right dosing is determined. And I think just to remind people of the trial sizes that were done, like with Pfizer, I think it was 44,000 people were involved in the clinical trials before this vaccine came to market. Moderna was about 30,000. These are sizes similar to fully licensed vaccines. So really, the safety profile, thank you, Dr. Koo, for those great slides and current information you gave us, especially on pregnant women. That's been a question and a concern, and people are very thoughtful about how they're making this decision. So I really appreciated Dr. Koo's stance on this, and really a call for all of us to listen, to be empathetic, and to be thoughtful in our responses with people. They are concerned, and it's okay that they're concerned. So I appreciate that, and more to come. Thank you, everyone. We had lots of people on the call, and we hope this was helpful.
Thanks, Nancy. Dr. Koo, any last comments?
No, I had struggled a little bit with how much to put in here, but I think that most of us were able to get the information, these facts and such, and regarding the vaccines. I think what I really want to relay to everyone is that it's how we convey this information. There's just so much information out there, and I think that it's easy for us to kind of fall in the trap of, here's a patient handout, just read it and you're all good. It's a lot more complicated than that. And if our goal is to get that herd immunity, we can't just assume that everyone those who decide to get vaccinated because of that handout, it would be sufficient. We got to expand out to all these other groups with reasons why they're not wanting to get the vaccine. This is my purpose of the presentation, and I hope I was able to convey it effectively.
Thank you so much, Dr. Koo. Thanks everyone for joining us today, and have a wonderful afternoon, and we'll see you next week.